Thank you, Dr. Nehakakar, Dr. Manish, and Sahani sir. Good evening, good afternoon, and good morning. This is the 1464th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Amit Sahani, the fourth generation doctor from Sahani family. And we invite all to this session, and let us begin the session with 1 minute silent prayer. Thank you all. We just celebrated our fourth anniversary some 3 days back, and today we have a wonderful guest from Dr. Sahani family. That is the fourth generation doctor from Sahani family. That is Dr. Amit Sahani, has completed his MD and working at the Professor Department of Repertory, RBTS Government Homeopathic Medical College and Hospital, Muzaffarpur, Bihar, and has completed PG in repertory and is author of a conspicuous, a widely followed book by PG students. Dr. Amit is presently the head of Department of Repertory, RBTS, Government Homeopathic Medical College, Bihar, and is associated with many associations: Homeopathic Medical Association of India, Lega Medicom Homeopathic International, LMHI Homeopathic Science Congress Society, and many others. He is also a member of Indian Science Congress Society. He is presently the General Secretary of HMAA, Bihar State, and Dr. Sahani is also active member of a social organization like Rotary International and YMCA. And Dr. Amit is also sought as a resource person for seminars and by reputed organizations like Bihar State Health Society and Bihar Voluntary Health Association. Doctor has published many publications by his name. I am not mentioning about all. There are so many things with him. He has won many awards, including Best Teacher Award in 2019, and he has won the Organization Award during the year, as well as Cancer Institute from the Cancer Institute of Homeopathy National Seminar for Cancer and Homeopathy. He has presented various papers on nationally as well as international platforms, and he is a resource person to some of the medical colleges and homeopathic department in different universities, and he has published beautiful books in different situations by B. Jain, and so other publications also there. And there are a lot of, you can see all these things in our posters. So I am not spending too much of time on this. Today, Doctor will be discussing about concept of grand generalization in homeopathy. Dr. Amit has presented so many beautiful sessions in the forum, and let us proudly welcome the guest of the day, Dr. Amit Sahani. Welcome, sir.
Thank you, sir. Thank you so much, sir. Thank you and good evening to everyone. And thank you to this IFPH forum for inviting me, giving me an opportunity every time, for giving me opportunities for so many lectures. So today my topic is on the grand generalizations, the concept given by Dr. Baning Hassan. So I'll be first starting with my presentation. Let me share my screen.
Yes. Yes, it's visible.
It's visible to you, sir?
Yes, yes, it's visible.
Okay. So we are talking on the grand generalization and the perspective from the homeopathic viewpoint. So let us begin our session. And with this, with the concept that Baning Hassan grasped very early in his career, he said that if a part is getting affected by any ailments, then it is the patient who is getting affected, not his parts. So he realized that man exists in his completeness, and symptoms are only its elemental presentations or expressions, we can call it. So symptoms are just the manifestations which needs to be taken care of. So they are just like the branches of the leaves of a tree. We have to go to the root, and that exists, and we have to understand the man as a whole. So with this quote, that bodily pain affects man as a whole down to the deepest layer of his moral being. So this is one of the quote given by Pope 12. Understanding man, or Homo sapiens as we know it. Life as Homo sapiens is a scientific name of man, as we observed, is a perfect body regardless to the disabled person, the physical defect or more. So despite our deformities, our defects, we are still Homo sapiens. We are still recognized. We do not say that a person who is disfigured or having some bodily disablement, so he's not a Homo sapien. He's still a Homo sapien, and that is the understanding the unity of the life, or the understanding the man as a unit. So when we consider man, it has to be these four parameters which makes the complete man: the mind, the body, the mind, the soul, and the spirit. So in totality, all of them collectively makes us. With this, another quote from Aristotle, which expresses the concept of grand generalization and the wholeness, the concept of the wholeness. He says that the whole is more than the sum of its part. So when we add all the parts, it should be less than what we understand the person as a whole. So whole is more than the sum of its parts. And yet another passage from Albert Einstein. He says that the fact that man produces the concept I, besides the totality of his mental and emotional experiences or perceptions, does not prove that there must be any specific existence behind such a concept. So it doesn't means ki if his totality is expressing the things and he will be different. We are succumbing to the illusions produced by our self-created language without reaching a better understanding of anything. Most of the so-called philosophy is due to this kind of fallacy. So this produces a misconception in understanding of the totality. This produces a misconception in our forming an idea of the completeness. So it is the concept of the person as a whole, which expresses his root behavior, his essence, which needs to be understood so that we can perceive him in totality. Every science, it begins by accumulating observations and presently generalizes these empirically. So we observe and we try to generalize the things, but only when it reaches the stage at which its empirical generalizations are included in rational generalization does it becomes a developed science. So when we try to translate these empirical generalizations and it qualifies as rational generalizations, then that generalization becomes a science. So this is yet another quote by Herbert Spencer, where I am trying to express the concept of generalization. So let us understand what generalization means to us from the homeopathic viewpoint. A generalization is taking one or few facts and making a broader or more universal statement. So we observe few things and we try to make some universal statement about it. So we try to generalize it. So the process of formulating general concepts by abstracting the common properties of instances. And generalization is the tendency to respond in the same way to different but similar stimuli. So it is the way of expressing the things. It is a way of way where we are trying to express the things in similar, maybe say not exactly the same way, but in a similar way. And we'll see it through the examples that that how the different types of generalizations can have habituated us in our actual life. So what is the basis of generalizations? How we try to generalize the things? So responses, they are generalized by allowing an individual to look at different place and find out the similarity of the presentations. We look at two pictures and we try to find out what is similar, what is the theme in this in both of the pictures, and we try to come out with a general concept regarding that picture or regarding that thing. So learning may be considered a balance of generalizations and discrimination. So discrimination is the ability to respond to the difference among the stimuli. And if there is an imbalance, it can lead to negative results. So to maintain the balance of life, it should be a balance between generalizations and discriminations. So it should not be over generalizations and it should not be over discriminations. So there should be a balance. Things should be generalized, as we will learn through the philosophy of Dr. Bonninghausen, and things should be individualized, as we'll see through the different philosophies of the repertory which have presented itself to the different generations of the repertorians. So this generalization involves applying past experiences to analogous new situations. So let us take for an example that there is some program, some application which has been trained to convert things into a past tense. So if it is a new word to that application, it will not be able to convert the word into its past tense. Whereas if that program has been just generalized to add ed before every after every word, then it will be able to produce the past tense of any word. And just as I have used here the word jump, so it will, you can add jump, jumped, and so it will become it will add generally it will add ed to every word that has been fed into this application, and it will produce the generalized past tense of that word. So it is just on the basis of the past experiences. So the software has been fed with the theme of adding ed to everything. It will add ed to everything and convert it into its past tense. So it is just the way of analogous learning. Now we have learnt of the two types of reasoning. In homeopathy, we have learnt of the deductive reasoning and the inductive reasoning, and how will try to draw the inferences or the appropriate use of the situations. So inferences, they are classified as either inductive or deductive. So deductive reasoning, here we try to see the reason and try to reach a conclusions. Whereas on the other hand, for the inductive reasoning, we try to look at the conclusion and try to look for the points which favor that conclusion. And so in deductive reasoning, which is also known as the deductive logic, is the process of reasoning from one or more statements, that is the premises, to reach a logically certain conclusion. So we'll look at so many examples, so many statements, we look at so many situations, and then logically we make a conclusion. So deductive reasoning, it goes in the same direction as that of the conditional and link premises with the conclusion. So they try to link the situations with the conclusion. So this is what we do in the deductive reasoning. On the other hand, in cases of the inductive reasoning, it is a method in which the premises are viewed as supplying some evidence for the truth of the conclusion. So we look for those premises we look for those situations which are in favor of the conclusion. It is also described as a method where one's experiences and observations, including what are learned from others, are synthesized to come up with the general truth. Many dictionaries, they define inductive reasoning as the derivation of the general principles from specific observations, although there are many inductive arguments that do not have that form. So that is what we have a concept of the inductive reasoning or the inductive logic, that we have a conclusion. We have already formed a general concept. We have already done the generalizations, and we are looking for the evidences, which we are looking for the situations which will provide a supporting pillar to that conclusion, or supporting pillar to that truth. So after this analysis, we go for the perception. In perception, when we go for the perceiving the things in the environment, we scan it by means of our various sense organs. We scan it whether they are real or artificial, and the scene is decomposed into separate objects in various spatial relationship. So we try to understand the things in its small elements. We try to analyze the things in its small elements. And analysis is complicated by the fact that an object may appear depending on the angle from which it is viewed, the direction and intensity of the illumination in the scene, and how much the object contrasts with the surrounding field. So there are so many things, which makes the perception, which leads to make a perception. So the way we look at an object, the light under which it is seen, and the contrast under which it is seen, so all of them, they make the same object look differently. So we have seen a number of illusions, visual illusions, which have been created by light in so many places. And we should understand that the actual thing, the truth is the same every time, and we are trying to look at it in different ways. They are being presented as a different in different light to us, but the actual thing, the truth, will always remain the same. And if we try to understand this truth in its parts, in its small elements, then we'll be able to reconstruct the truth entirely over again, without forming a false image or a false concept regarding that truth. So there are different forms of examples of generalizations which you can see, and the different letters, all of them marked with different symbols. Still, they all reflect the same. We have another example of generalization, where a person is recognized by his name and his mobile number. On the other hand, the same thing that in the first part of the upper part of the slide, you can see that it is the name and the mobile number which symbolizes the person, whereas in the bottom of the slide you can see two examples of student and a patient, where a student is recognized by his roll number, name and mobile number. On the other hand, patient by his patient identification and name and mobile number. So it is vice versa true. And this is what we mean by generalizations, that the bottom-up approach to generalization is also to make a general concept regarding that person, that patient, or that student. Now, coming to the different types of generalizations. So here I have listed 3 types of generalization. One is a stimulus generalization, another is response generalization, and the third one is response maintenance. So coming to the first one, the stimulus generalization. So behaviors are performed in the setting or in the presence of stimuli than those in which the behavior were taught. So it is just a different, it is just a type of stimulus generalization, and where we have a stimulus, and whether it is based on the past it is based on the past experiences. Let us take, for example, a person who was bitten by a dog, and now Now, every time he sees a dog, there is a morbid fear of the dog in him. So it is just a stimulus generalization. He had been bitten by a dog, and that has led to a general fear, a generalized fear for all dogs. So it is the behavior which is in response to the stimulus that has happened, and in which the patient has learned that the dog might bite him, and this leads to the stimulus generalization. The second one is the response generalization. Response generalization when the behavior changes that were not specifically targeted in the original intervention. So we have a person, and let us say, for example, as an example for this, I can say that in response generalization, it comes a situation then where the behavior will change, where there will be no changes in the original intervention. So you may we are in a habit of saying, say, for example, hi to everybody, but at times the response may change to hello, and or response may be like that, what are you doing right now? And so things can be different, but still the basic thing remains the same. The response remains the same, that we are trying to ask about the patient, the person of his well-being, and the response maintenance. So it occurs when the behavior is performed following the withdrawal of an intervention. Even when the intervention is withdrawn, the person has learned, and the response is maintained. So suppose we have learned something from our parents. Let us say, for example, in our childhood, we learned how to tie our shoelace. So somebody might have shown us maybe one time, maybe two time, maybe three times, how to tie a shoelace. Now, first, what we might have tried to do is we would have tried to copy. We would have tried to copy what the other are doing. And now, even after the withdrawal of that intervention, we are still able to tie our laces, and that is the maintenance behavior. That is an example of a maintenance behavior. So the generalizations have been classified as accordingly into stimulus generalization, response generalization, and response maintenance. Now there is a term called hasty generalizations. So and this is the thing that we need to be careful of. So for example, my friend has been only eating pizzas, hamburgers, fries for 10 years, and he has no health issues. Therefore, we can generalize that fast food is not unhealthy for you. So this is a generalization that we draw just by looking at one evidence, one person. So this is a logical fallacy. And we will call it as a hasty generalization because this is a logical fallacy, and this occurs when someone draws a conclusion which is just based on a very small sample size. We are just looking at one person and we are saying that this is good for us, this is not unhealthy. In other words, the conclusion is supported by insufficient evidence. There are not sufficient evidence to make that generalizations. So generalizations should always be based on a good sample size, and most importantly, should be unprejudiced. So generalization should not be prejudiced, as Dr. Hahnemann has also told us everywhere not to be prejudiced. Now, coming to the homeopathic aspect of this grand generalization, the concept of grand generalization in homeopathy was largely preached and practiced by Dr. Bonninghausen. It was Dr. Bonninghausen who introduced this concept of grand generalization into homeopathy through his different repertories. He was following the developmental stage when early developmental changes in a young science were giving shape to its analytical principles of prescribing. So Dr. Bonninghausen, at the very outset, with his construction of this repertory of the antisoric, he came up with this concept of the grand generalization. His repertory, all the three books are based on the concept of the grand generalization. He has tried to separate all the symptoms into different components, into categories, and only with the theme that when all these components, they are united together, the the medicine doesn't change, the meaning doesn't change, and most importantly, the medicine will not change. So coming to Baning Hassan as a person, Baning Hassan's career began with a legal profession, and he was not a person of a medical background, and still he adopted homeopathy, and that was in his mid-40s. He was a very fine thinker, and as such, he had no difficulty in grasping the basics of homeopathy and advanced it a few steps further by his immense literary contribution. So we have had a look at so many literary contributions by Dr. Baning Hassan. His most importantly his 3 repertories and a number of other papers and books published by Dr. Baning Hassan. So homeopathy has definitely gained from this Dr. Baning Hassan. Now, Baning Hassan's understanding of the disease was that man becomes sick as a whole, and it is not in his parts. Therefore, what is related to a particular organ is also related to the whole organism. So he at the very outset, he grasped this idea that what affects any part can affect any part, and therefore it affects the whole. So it cannot, it is not that ailment will be only affecting one part. It can affect any part. And since it can affect any part, it can affect the person as a whole. And most importantly, we have to see that it is the repertory which was made by Dr. Baning Hassan. It is entirely a different kind of repertory. He has tried to dissect the symptoms into its constituent parts, and he has tried to give the definition of the complete symptoms into its 4 components. He has said it is location, sensation, modality, and concomitant, and he called it as one grand symptom. He has called it as one grand symptom. And so he formulated, he formulated 7 different questions to find out the whole pattern of the man's sickness. We all know of that hexameter given by Dr. Baning Hassan. Now, the philosophical understanding of a patient, how we are going to understand the patient. So that hexameter of the grand generalization was coming from the lesser writings of Dr. Baning Hassan. In the verse is the following. It is the quis, quid, ubi, cubus oxylus, cure, cumodo, and quando. So these 7 rubrics designated in its maximum seem to complete all essential momenta which is required in the list of complete image of the disease. So if we want to form the totality through the Baning Hassan way, we have to go for the evaluation of the symptoms in a case as per this hexameter. We have to understand the patient first. If we have to understand the patient as a whole, thereafter we have to understand what is the disease that he is suffering from. Thereafter, the seat of the disease. Then any auxiliary symptoms are there or not. Then the cause of the disease, and then comes the cumodo, the modalities, and then the time-related modalities. Then apart from all this and the repertories, of course, Dr. Baning Hassan, he is known for his contribution to homeopathy, and he introduced certain terminologies. The concept of concomitant was given by Dr. Baning Hassan. He gave emphasis on the modalities, and he gave the concept of the generalizations. So these are some of the things which have been introduced by Dr. Baning Hassan into homeopathy. Coming to the generalization and individualization, Baning Hassan's approach in a case analysis is perfect amalgamation of the generalization and individualization. So grand generalization is a beautiful process. Concept is a beautiful process for individualization. So we'll see it that through grand generalization, it helps us to individualize the patient. It is not that it is just the generalizations. It is the generalizations as per the theme of the patient, as per the symptoms of the patient which are generalized, and thereafter the ultimate aim of the homeopathic prescription, that is individualization, is equally respected in this concept of grand generalization. The idea that the symptoms can be taken apart and separated into its category and then again reconstituted to form the symptom again was the theme, that was the concept of the grand generalization. A sensation or modality affects not only the single part of the body, but it affects the patient as a whole. So we have to understand this thing, and this is the very intuition, that this is the very basic thing of the homeopathic medicine, and that any of the proving, it doesn't affect the patient in the local area, it affects the patient as a whole. So if we say ki, let us take for example, we know that it is written in the chronic disease that brainia, the pain is the knee pain is more on moving. But when we try to generalize it as per the Bonninghausen's concept, we say ki the brainia movement in any part of the body is it aggravates the motion aggravates any complaints of the body, pain in anywhere in the body. So is it not true? Is it not true? It is true. We have seen this one line from brainia being translated from a particular symptom and being qualified as a general symptom, and still it is helping, and it forms the one of the key concepts of the brainia. So generalizations to individualizations and individualizations to generalizations is the theme of this of this repertory of the therapeutic pocketbook. So understanding the symptoms by its analogy. So how we form the basic theme, the basic analogy or the grand generalizations. So breaking the complex symptoms of a proving of a case into the components of dimension of locality, sensation, modality, maybe causations, and concomitant, allowed Bonninghausen to construct the first and easy to use repertorial index to the Materia Medica. So we have to understand that this Bonninghausen repertory is very different kind of repertory. This Bonninghausen repertory, it is based on the concept of the location, sensation, modalities, causations. So we have to look at that entirely in a different perspective. So if we believe that believe the concept of the grand generalization, if we believe that the concept of the grand generalization or analogy is correct, then we have to understand that it is the patient which is complete, and not the symptom which is expressing the disease. It is the patient which has to be understood first, and through his locations. We have to understand the patient as a whole, followed by the disease in its locality, in its the generalized locality, in its generalized sensation, in its modality, in generalized modalities. So let us see it through an example from language as symptom from the Herring's Guiding Symptoms from Arsenic album. So the symptom as given in the text is: on lying down at night, feels an oppression in the chest. The breathing became short, is obliged to sit up in bed. Worse after midnight. Drinking coffee or sugar with water relieves somewhat. Symptoms worse on going upstairs and getting out of breath. So this is just one line from Herring Guiding Symptoms from the Arsenicum album. Now let us see that if this symptom had to be repertorized using the synthesis repertory, what rubrics would have taken. So the first rubric would have been chest oppression, which is expressing the sensation of the patient. Then general lying aggravate, which is expressing the modality. General night, yet again modality, night aggravation. Then respiration difficult, this is yet another sensation of the patient. Respiration difficult, lying impossible, this is yet another modality. General night, midnight after, and then food and drinks, coffee ameliorate, and respiration difficult exertion after, or we can also take general exertion physical aggravate. So this is yet another modality. So understanding the patient through his sensations and modalities in this case, and when I repertorize this case, from the synthesis repertory, arsenic came up as the repertorial result along with two other medicines. That was Nux vomica and lachesis. So uh, the the best thing about this concept of the grand generalization is that although it is written, although the language was written as it is in arsenic uh, in this herring guiding symptom, and we are coming up to arsenic after repertorization using the concept of generalizations through the synthesis repertory here in this case, for example, and we are coming up to arsenic along with other possibilities that could have been that would have been possible for this situation apart from arsenic, that is Nux vomica and lachesis here in this case. Now I have repertorized this case using the therapeutic pocketbook also, and the repertorial result, the rubrics that I have taken here is from the sensation and the complaints chapter. The external parts of the body and internal organs in general, there is oppressive pain that is producing a feeling of oppression. So this is a generalized oppression. This is not oppression in the chest. And this is for the generalized oppression. Then changes of the general state, it is aggravation lying down after. So this is again a general aggravation state. Then parts of the body and organ under the respiration subchapter, it is oppression of the breath. Then aggravation, time according to night and midnight after, and aggravation from exertion of the body, and amelioration, food and drinks from partaking certain coffee. And the single medicine that came up using the therapeutic pocketbook analysis for this for the same symptom that was given here in the herring guiding symptom here is arsenic album, and through Bonninghausen therapeutic pocketbook we are again getting this arsenicum album. So we have to understand that this grand generalization has is not what it has been criticized for. Grand generalization, Dr. If we believe Boger, who was one of the biggest followers of Dr. Bonninghausen's philosophy, and he wrote he constructed this Boger-Bonninghausen characteristic repertory. So he has tried to take the best of the Bonninghausen, the concept of the grand, convert it into better repertory from the present context. And we see a lot of examples of the cases from the Boger, especially through the cases that have been given by Boger through his conceptual repertory. Number of examples of the grand generalizations coming up with actual results. So and we have to understand that the concept of the grand generalization is not altogether which can be ruled out. Now let us look at some of the limitations of the concept of the grand generalizations. Now, from the proving of the colosynth, it reveals that there is pressing pain in many localities, but indicate amelioration by hard pressure only for colicky pain of the gut. So it reveals that there are pressive nature of the pain in so many locations, but amelioration by hard pressure for the colicky pain is there only in the gut region. Bonninghausen lists, as according to the philosophy of grand generalization, Dr. Bonninghausen has generalized this symptom of pressure amelioration as this pressure amelioration colosynthesis has been mentioned, but pressure is the gut region that is helping the patient, and a pressure elsewhere will not help the patient. Am I audible, sir?
Yes, everything fine.
Okay, okay. Okay, sir. Thank you. So we were talking of this pressure ameliorate symptoms of cholesynthesis, which has been mentioned in Bonningham therapeutic pocketbook under pressure ameliorate. And among the other medicines, colocynth is there. So pressure in the external is there in the in this therapeutic pocketbook, and which allows us to consider this remedy in cases where even pressive headache is better with hard pressure, even though this modality is not reported for this locality in the proving. So this is so if we use this colocynth in case of a pressive headache, which is better by pressure, and if we apply colocynth to this patient, we definitely will not get the result. Definitely will not get the result. So we have to understand this concept of grand generalization, and we have to take into consideration the limitations of this concept of grand generalizations also. Many classical authors, they have criticized this concept of grand generalizations by Dr. Bonningham. So criticisms we can understand, we can categorize it into two heads. So one is key information is lost when locally specific non-generalizable modality or sensation is stripped off from its local symptoms and treated as a general symptoms. So when you take local symptoms and convert into a general symptoms, so the actual information is lost. And second is when the information is distorted. And when a non-transferable local modality or sensation is applied to another symptom inappropriately. So suppose what the grand generalization says ki the pain in the head is ameliorated by pressure. So we expect that the pain in the leg will also be ameliorated by pressure if in case the patient has not described it. So this information is a distorted information. So we are not getting the correct picture from the patient. So this is what the critics had to say about the concept of the grand generalizations. Then again, Dr. H.A. Roberts, he views about this concept of the grand generalization in the following points. He says that Bonningham himself recognized that even the best possible case taking, the record is often left in an incomplete or fragmentary state. So even when we are trying to complete the case, some of the cases, some of the symptoms may be left incomplete. So this is because the patient may not be able to tell it in the exact sensation, in the exact modalities. So it is reflected to us in a vague manner. In some instances, the localities and the parts affected are not stated. In other cases, the sensation of affection or affection is not indicated or described in an intelligible manner. Most frequently, the conditions of aggravation and amelioration of the particular symptoms or the patient's general condition could not be stated because patient's lack of observation. So in some of the symptoms, the exact location may be missing. In some of the symptoms, exact sensation may be missing, and some of the symptoms, the modalities may be missing. So this is a practical difficulty, which led Dr. Bonningham to formulate this principle of analogy or grand generalization. And the idea was to complete the totality. The idea was to complete the symptom. So that was the basis. That was the reason why grand generalization was formulated by Dr. Bonningham. Now, the practical difficulty that we face, while applying this grand generalization is that if, for example, it was possible by questioning that the patient to decide what aggravates or ameliorate a particular symptom in a case, and the patient would readily express a condition of amelioration of some other symptom. So it did not take long to discover that the condition of aggravation or amelioration are not confined to this or that particular symptoms. So it's in the modalities, they are not limited to the particular symptoms, but they are actually the general modalities. So he said ki it is like the red thread in the cordage of the British Navy that apply to all symptoms of the case. So it is a generalized modality. It is not a particular modality, and it has to be considered as a general modality. But the practical difficulty is that some of the patients, they may be having the rebellious modalities. They may be having the rebellious modalities. For example, one of the part may be better by hot and the other part may be aggravated by hot. So this type of rebellious modalities, they pose a difficulty. They pose difficulties for understanding this concept of the grand generalization, and we need to use it. We need to use it very carefully. So there is high risk in the grand generalization. The freedom available in the grand generalization is a high risk. So we are at liberty to generalize the symptoms. We are at liberty to convert the symptoms into general symptoms. And it excites in the prescriber his innovative capabilities, and it can lead to disaster. It can also lead to blunders, because under the pretext of generalization, we cannot generalize symptoms to any extent. We cannot generalize, overgeneralize. And overgeneralization was one of the reasons why this grand generalization has been criticized. So going by the Fatak's view, in the preface of his repertory, he writes that Boger had the knack of generalizing the particulars. He seems to be praising this procedure of Boger and Bonninghausen by giving an example of particular awkwardness in the limb, which was generalized by Boger as awkwardness of mind and the body. Now, this generalizations by of the particular part cannot be considered as awkwardness of the mind and the body. Then again, Patak quotes that from his practice some examples and also convert some of the particulars into generals in his repertory. For example, in one, he has successfully used the rubric unsteady sensation by generalizing it. That made him to upgrade the same in his repertory. He does not mention, however, whether the upgradation was based on a single observation or on multiple cases. So whether he has generalized this sensation using a one patient, keeping one patient as an example, or he has taken the sample size of a bigger patient, that we do not know. But he has definitely followed the Boger's principle of generalization, and he has converted this symptom into a general symptom. So understanding the generalizations and the peculiar symptoms. So free generalizations of any symptoms, one may not be able to appreciate the characteristic symptoms. So again, let us take an example of bryonia. So bryonia has dryness of the mouth with thirstlessness. And this is one of the keynote symptoms. This is one of the most important symptoms for the keynote prescribers. And this thirstlessness associated with dryness of the mouth cannot be generalized as thirstlessness in bryonia. So we cannot call it as bryonia under thirstlessness. It is dryness with thirstlessness. Secondly, lycopodium does not have 4 p.m. or 4 to 8 aggravation as far as diarrhea is concerned. And so in general, lycopodium, we know that lycopodium has got a 4 p.m. aggravation or 4 to 8 p.m. aggravation in all other complaints, but not in case of diarrhea. But if we go by the Bonninghausen principles, if we go by the principles of the grand generalizations, we'll have to generalize this 4 to 8 p.m. and we'll have to consider lycopodium under it. And if we prescribe it in a case of diarrhea, we'll not get the result. So for 4 to 8 p.m. aggravation in cases of diarrhea, the medicine is podophyllum. Lycopodium cannot be prescribed blindly for any symptoms that causes up to 4 p.m. Likewise, involuntary stools, they call for aloe, while involuntary urination calls for other remedies. And if we take involuntary talking, that is loquacity, it cannot be aloe. So everywhere where it is involuntary, so involuntary cannot be generalized. So this is overgeneralizations, and this doesn't go with the principle of grand generalization, and this doesn't go with stand true in all cases. So we have to be very much practical when we are trying to generalize the symptoms. We have to be very much analytical when we are trying to generalize the symptoms. And we have to be very much rational. Most importantly, we have to be rational when we are trying to generalize the symptoms. Everything need not be generalized. Coming to the generalization of the mental symptoms. Innovative generalizations of the physicals, when carried up to the level of the mind, becomes uncontrollable, and we are seeing so many interpretations of the mind symptoms by different authors who are coming up with a generalization of the mental symptoms. So fear of falling, what does it mean? So when we go to the Kent repertory or any other repertory, we should go by the author's interpretation, and the medicines which have been prescribed under fear of falling, they simply stand for the fear of falling down from a higher place. It is not like that. Can we generalize it as a fear of falling from some higher position in life? Like, say, a rich person who has become poor, or maybe an honorable person who has lost his respect. So can this also be a fear of falling? So is this also, can the medicines which are described under the fear of falling can be considered as fear of falling from his position? So we have to be very much rational when we are trying to convert the symptoms, the mental symptoms into as a general symptoms. We cannot generalize because the mentals, they are already generals. Confusion arises in the generalizations of the mentals with misinterpretations of the rubrics. Interpretations of meaning are being tried, leading to diverted views from the author's view. The author who has made the repertory, and how we are interpreting those rubrics, it is very important, because ultimately we have to understand, we have to realize that it is the author's view which is more important, because ultimately the medicines which are reflected under that rubric is from the author's viewpoint. It is not from our viewpoint. So interpretations of meaning are being tried, leading to diverted views from the author's view. Mentals are very specific in nature of an individual. As such, they cannot be generalized. They are in fact general symptoms. Dr. Bonninghausen had kept the mental symptoms only for individualizations from the Materia Medica. So going by the Bonninghausen Therapeutic Pocket Book, we all know one of the shortcomings of the Bonninghausen Therapeutic Pocket Book is lack in the number paucity of the mental symptoms, and a small number of the mental symptoms. So Dr. Bonninghausen, he said that mentals, they are not very much clearly demarcated in the patients, and they can be, if available, this should be used for the purpose of the differentiation. This should be used for the purpose of individualization, and that is why he reasons that the number of the mental symptoms given in the therapeutic pocket book, they are very small in numbers. Understanding the Kent's view on this concept of the generalization is the practical approach in the clinic requires understanding of the present situations. He says that everything cannot be generalized. There are symptoms which are in contrast to the generals. There are symptoms which appears as rebellious symptoms. There are characteristic particulars which draw the attentions of the whole case. So there are we have to go by the case, and ultimately it is the case which will help us to decide the medicine, and the case is reflected through its symptoms, and we try to individualize the patient through his individual symptoms. So we cannot try to generalize every situation, every symptoms, because overgeneralizations will lead to some mistakes in prescribing. So the practical approach is, we have to go for the individual approach. We'll have to for the realizations of the realities, and eliminating the delusional thoughts. We cannot keep imaginary symptoms, imaginary generalizations as our basis for prescriptions, and accepting the ground realities as having a rational approach to generalizations. So that is, thank you, sir. Thank you for giving me this opportunity to present this concept on generalizations. And
Thank you, Dr. Amit Sahani. It's really a beautiful session indeed. You really show why the generalization become a necessary and how it affect, and then what are the complications that can arise when you generalize things, and as per Bernie Hussein's theory, you really narrated things in a beautiful way. Thanks for your excellent presentation.
Thank you,
It's
sir.
it's a time for a discussion. If anybody want to have a question or want to talk to Amit Sahani, please raise your hand, as there is only a few minutes remaining.
I think, Dr. Dhanesh,
Yes, sir.
while I was listening to these generalizations, one
Yes.
thing that I'd like to mention, that to be the practical approach, this is the best thing. But what we see now, what the evolution of the repertory which is going on and is still going on. So beyond the Boger-Bonix and characteristics repertory, we see the repertory by Barthel and Blanker, that is the synthetic repertory, which is in 3 volumes. And it is I see that this is the generalized way of presentations where it has been made. But later on, I think it is not so much, it didn't become so much popular. But again, we further see that there is another concept coming in homeopathy, and it is being utilized by most of the senior practitioners, like thematic mathematics and thematic concept, getting the theme of the medicines and then making a thematic repertorization. And the new repertory which has emerged up with the thematic repertorization is by the middle. I think it is by Midley. I think just
Josh Medley.
Josh Medley. He was like that. So, and I was trying to read that books also, and try to repertorize. But to some extent, it is very much useful for the chronic disease. But still in the chronic disease, we have to be careful that we have, whether it is what aspect of the generalization has to be taken and what aspect of the limitations of the particular has to be taken. So this is my concept, that this is my view that I wanted to add. Yes, sir.
Yes. If anyone want to have a chat, please raise. As just only a few minutes remaining. I think
We have one more book from translation of Dr. Boninghassen by George Demetridis. So this is also one of the very good book where we see ki lot of examples he has given in the introductory part of the book, where he has tried to convert the symptoms from the chronic disease and repertorize it according to the therapeutic pocketbook, having the concept of the grand generalization. And he has given so many examples there. So this is also a good book to read by George Demetridis regarding this grand generalization.
Okay, that's good. And I am inviting Dr. Rambaresa to say vote of thanks to this session, sir. Please unmute. Please unmute. Yes, sorry. Once again, please unmute.
Thank you, Dr. Dhanesh, and congratulations, Dr. Amit Sahani.
Thank you, sir.
Very nice presentation, excellent session. Concept of Boeing Hassan, philosophy, location, sensation, and modality. Very good, beautiful describe the session. Very, very thanks. Behalf of IFPH, whole team, very, very thanks again. Presentation. Every presentation is a dynamic.
Thank you.
So very nice and dynamic presentation. And again, IFPH presentation. Very, very thanks. Thank you.
Thank you, Dr. Sahani and Sahani sir. Then those who participate in the session. Tomorrow we will have a session from Dr. Srinivasan, and Doctor will be talking about nurse obstetric. That's he's always taking a discussion on nurse repertory. So with that, we come to the end of the day 1464. Thank you all. Good night.
Thank you. Thank you. Thank you.
It's over to Dr. P. Shaila to moderate the Malayalam session.